welcome to IPASS Online Academy. So today is another special day because welcome to Hope Talk. Hope Talk is actually a testimonial of our pastors. Ayan. So we interview the people who have been through this NCLEX journey and who already aced their NCLEX. So for us to also be inspired by their story and of course to observe how they did it, and somehow maybe it could also help us. So ayun. Without further ado, let us start our Hope Talk for tonight. Let me introduce our guest for tonight. He already passed his NCLEX and he is one of our pastors. Let us all welcome Sir Arbert Saliona, USRN.
Hi, sir. Good evening, sir. Good evening dyan sa Pinas. Good afternoon from Dubai.
Ayan, galing pala Dubai. Okay.
Yes,
So, nasa Dubai kayo ngayon, sir?
Yes po, sir. Nasa Dubai po. Good evening, classmates.
So, ayan, sir. Before anything else, I would like to just check on you, no? How are you right now? How do you feel?
Actually, nasa Cloud9 pa din, sir. And kanina lang kasi galing ako ng NCLEX kaya hindi na nakauwi ng bahay. So, dito na lang kami sa may restaurant ng pamilya ko. Kasi kung uwi pa kami, it will take time sa traffic. Hanap na lang ako dito sa gilid muna.
So, ayun, no? Cloud9 pa rin. We are very excited to hear your story and how you did it. So, can you give us your nursing education background and of course, your nursing experience and how did this NCLEX came up?
I graduated Bachelor of Science in Nursing po noong 2009 sa University of Mindanao in Davao City. And then at the same year, I took the nursing board exam also, November 2009, and passed. I started working po sa community namin because I am from Sarangani province. I'm from Glan. So nagsimula yung experience as a nurse doon sa isang maliit na community hospital sa lugar namin. After 2 years, nag-decide ako na mag-venture to city. So nag-work ako as emergency room nurse / assistant head nurse ng emergency department sa St. Elizabeth Hospital sa Jensen. And then noong 2016, I was able to pass DHA and HAAD together. Kaya po pumunta ako ng Dubai. Nagpunta ako ng Dubai noong 2016 and nag-work din po ako sa emergency room dito sa isang hospital sa Dubai. And then after 2 years po, nag-shift naman po ako ng career. Nag-ano po ako, outside hospital po, hospital setting po, nag-EMT po ako. Una-una, dati po akong EMT sa Dubai Immigration po, sa jail. And then ngayon po, under Dubai Ambulance kami, sa jail pa din po. And yung NCLEX journey ko po nagsimula, step 1 po is DIY lang po yun, noong 2019 pa. Ginawa ko lang po siya dahil sa gusto nga namin na gusto kong mag-NCLEX that time. Nag-pandemic and then 2021 ng December, parang nainganyo na naman ako na mag-start ng NCLEX. Kaya nag-inquire ako sa IPASS. And then only to find out, meron pala din silang IPASS Academy. So nag-enroll po ako. Exactly last year, February 8, yung first day ko po ng klase ng IPASS. So imagine, from last year, estudyante lang po ako. Ngayon, USRN po ako. Yes po.
Sakto, February 8.
February 8, 2022, yung first day ko po na class with Sir Ryan. So ngayon po, ako na nandito sa harap niyo.
Anniversary sa IPASS.
Bali po pala nung second take ako. Nung nagbakasyon kami sa Pilipinas nung June 30, nag-exam po ako sa Pilipinas. But then di po pinalag. Natapos po ako ng 145 at that time. So, nag-stop lang ako ng mga isang buwan. Pagbalik namin dito, review ulit. Pero yung review process ko na for the second time, hindi na yun kagaya nung sa ginawa ko nung first time. This time, nag-focus na talaga ako sa klase, sa lahat ng lectures. Kasi parang that time, sinasabi ko lang sa sarili ko na parang okay lang yan, papasa din ako, kaya yan. Parang wala yung wala yung commitment sa klase. Wala yung parang relax ka lang. Third this time kasi parang tinaga ko from yung after failing the exam hanggang sa nung nag-take ako ng January 10. Lahat yun consistent. Pinalo ko talaga kung ano yung ng mga educator natin.
Tapos ayun sir, ano yung mga naging experience mo, kumbaga naging struggle mo during your review?
Yung struggle po sir, meron kasi akong 2 toddler. Meron akong 2 anak. So doon talaga sa bahay, hindi talaga ako nakapag-study. Yung ginagawa ko kasi, yung klase ko is yung trabaho ko kasi hindi relax lang. Nasa jail lang kasi ako. So for yung sa 12 hours na yon, almost like 8 to 10 hours na yon, nagkaklase ako habang walang pasyente. Then pag ano naman po, pag off duty, sinakagong gumising ng maaga like from 2 o'clock hanggang 7 o'clock ng umaga. Aral lang din po yun.
So nagpuyat-puyat ka rin, sir, no?
Puyat, sir. Dati, sir, nung 2020, meron akong bilateral na carpal tunnel. So, nung 2021 po, pina-opera ko to. Then, sa klase na to, sir, syempre, sulat ng sulat. Bumalik.
Oh.
Bumalik tong dalawa. So, wala eh. Kailangan kasi magsulat. So, lahat ng klase, sinatsaga kong isulat yon. Piniprint ko, sinusulat, tapos pinabalikan agad-agad.
So sir, narinig ko dun sa sinabi mo kanina, no, na you took your first NCLEX no June 30,
Yes,
2022, and I could also relate to you, no, because I myself also failed the NCLEX once. How did you feel nung mga panahon na yun, sir? Ano ang kumbaga parang naramdaman mo when you failed your NCLEX?
Siyempre, sad, sir. Kasi yun nga, yung expectation ko din kasi andun. Pero yung isang factor din siguro kasi parang pati yung focus ko. Sorry. Yung factor ko kasi hati ba? Kasi after 5 years kasi yun yung una kong bakasyon sa Pinas. Kaya siguro yung mas inuna ko yung bakasyon kumpara sa exam. Isa din siguro yung factor na yun. Kaya medyo 50-50. Natapos ako ng 145, I think, mga 4 hours po yun. Hindi ako nagkakamali.
Tapos sir, ano yung mga masasabi mo sa experience mo na parang feeling ko ito yung nagkamali eh. Kaya na dapat kong baguhin. So para next time, ipasa ko na.
Well, siguro yung ano ko lang talaga nung nakaraan, yung mali ko lang talaga is consistency. Wala ako noon, consistency. At wala yung commitment din doon sa kung ano yung pinasa mo. Kasi pag NCLEX kasi akala natin parang okay lang. Siguro sa iba, like for example, nakapasa ng HAAD, nakapasa ng DHA or any other exam, parang iisipin natin, papasa din ako niyan kasi same lang yan, exam lang yan. Pero hindi eh, kailangan mo talaga siyang paghirapan. Yung parang ino-nurture mo yung sarili mo na parang kailangan natin ito magawa kasi para sa goal natin.
Ayun, I would just like to know, ano yung mga, nung June, sir, part ka na ng IPASS noon? Tama ba?
Nagsimula ako sa IPASS February 7.
Pero hindi mo siya masyadong
na uma-attend ako ng klase para lang sa sake na nagklase ka. Alam mo yung pinapakita ko lang sa asawa ko na, ito yung ginastos natin ha. Nagkaklase ako. Pero yung parang passive lang lahat. So,
wala talagang retention.
Walang retention, wala. Nag-U-World pa ako noon pero parang yung U-World natapos ko siya na parang wala lang. Parang yung ginagawa ko lang noon dati is pinapakita ko lang sa asawa ko na ito, nag-aaral ako. Nag-aaral ako. So, parang memorize ko lang yung mga sagot noon para sabihin lang yung parang aim ko lang kasi that time yung practice na before ng June 30 ko na exam is parang gusto ko lang makapasa sa mga exam. Kaya halos lahat ng mga exams sa year almost parang memorized lang. Wala talaga yung parang gagamitin yung critical thinking mo kung paano sumagot ng mga atake ng question. Yun talaga yung mali ko that time. Which is aminado naman ako.
Ayun, no, one thing, no, talagang ang ganda, sir, nung sinabi mo, no, even though siguro para sa'yo na ano lang yun, no, that was your observation. Pero that's really true. That's really true. Alam mo yun, kahit pa nandito na, no, sabi ko nga kahit nandito na yung solusyon for you to pass, if you will not really be serious about it, you will not commit yourself to it, na marami kasi dyan talaga, uma-attend ng review or kahit recording, just for the sake na, para kung marami na akong matapos, kasi goal na ako eh. So, kailangan matapos ko to lahat. So, minsan, papakinggan lang nila. Yung iba nga, pinapakinggan pa habang tulog. Pag ganun kasi, no, iba din talaga eh, yung knowledge, kumbaga, hindi talaga siya na-absorb. And tulad ng sinasabi ko, if you will not really study hard, no, hindi mo talaga isa i-absorb. Ang mangyayari dyan, siguro after a month or after 2 months, ang mangyayari dyan, you will remember those topics, but you don't know what it is all about. Kumbaga parang, ay, nabahasa ko to eh. I've already read about this eh, but I don't really remember kung ano bang ano to. So something like that, no? That's really what is happening, no, sa ating mga students minsan. Lalo na if you don't really try to understand the topics. So So that's what happens. Sabi mo nga, no, be serious about it. Na you lack the seriousness. Most probably, no, what I saw is maybe we also lack the respect for the exam because we thought that the exam is just a simple exam. Kumbaga, just take the exam. Parang narinig ko sa'yo, sir, kanina, you told us na NCLEX is different.
Different talaga, sir. Kasi, although lahat naman ng exam, pero iba din kasi pag sinasabing NCLEX, yan ay yung parang yung pinakamataas na ano natin yung para sa nursing career natin. Di ba halos naman lahat tayo yung goal natin is to go to America. And yan yung isang stepping stone which is dapat hindi natin sa parang i-small lang. Bigyan talaga natin siya ng importansya para makamit natin.
Ayan. Kasama rin natin ngayon, no? I would just like to acknowledge the presence of Ma'am Rachel Olivar, our president.
Good evening, ma'am.
Hi, Sir Arbert. I'm able to hear your story. Kaka-join ko lang. But I'm very pleased that I'm able to join this testimony. Yesterday, wala ako. And I'm very glad na you have already made it, Sir Albert. So, makikinig muna ako. So I can catch up with your storytelling.
Ayun, ma'am, no, just to also enlighten everyone, lalo na yung mga bagong dating din. Sir Arbert took his first NCLEX last June 30, 2022.
Yes,
so he's also one of us, no, retakers. So ayun, no, we can really relate to it. And tulad nung sinasabi ni Sir kanina, Sir Arbert, he was kind of belittling the exam or not really so serious about it because of ano bang naging reason, sir? Bakit parang hindi tayo masyado naging serious na sa NCLEX? Or
kasi parang iniisip ko lang din kasi dati yung nakapasa ako ng DHA, nakapasa ako ng HAAD. So alam ko sa sarili ko na papasa din ako ng NCLEX. So, yung mindset ko kasi noon is nakapag-enroll na ako ng IPASS. So, lahat ng klase ng IPASS dapat attendan ko. Pero yung klase na pag-attend ko sa klase ng IPASS is parang, alam mo yung passive lang. Yung for the sake of attendance. But in which is mali talaga yun. Kasi dapat seryosohin talaga natin every class. Kahit yung mga detailed na mga klase, kailangan talaga natin na parang pagbigyan talaga ng halaga kasi magagamit talaga natin yun on the day ng exam, which is yun yung lacking ko on the first one.
Just to emphasize, no, nagandaan ako, sir, sinabi mo kanina, no, na NCLEX for me, for you is the highest exam, and you told us na parang hindi mo pala ito mapapasa ng ganun-ganun lang. You really have to give your focus to it, and that's very true. Yung sinabi mo na you have to give your effort to it. It's just the same with our local boards. Of course, we took special care with our local boards.
Yes po.
But this NCLEX would not just give you a title of being an RN. It will give your future and the future of your family. No,
Yes,
it will give you actually your green card. So if you have watched Ma'am Rachel and mine's webinar few days back, we talked about how easy it is to have your visa after you pass your USRN. So ito yun, no? This is something that will change your life. No? This is not just about a simple exam. And kung on our local boards, we try to do everything. Marami pa nga tayong kasabihan. We have a lot of superstitions like kick the chair, go to different churches, light some candles, offer some eggs. So, we have different kind of preparation during our local board, and why not put the same effort, why not put the same energy or even more, di ba? Kasi this is not just about the title, this is about your future and the future of your family, and that's one thing, no? Sabi ko nga, ma'am, kay Sir Arbert kanina, one thing I realized doon sa kanya, what happened to him, sabi niya parang easy lang naman tong NCLEX pumasa na nga ako pumasa ako ng DHA, no? It's almost the same thing, no doon sa ating na-experience ko. I really belittle the exam, no? I really lack the respect, kaya lagi ko sinasabi sa coaching session, pag meron akong student, lagi ko sinasabi, first of all, respect the exam, because if you don't respect the exam, no, the thing is we tend to be, for example, there are a lot of people, we also have our Hope Talk before, and we interviewed someone who is already a clinical instructor. And he told us na CI na ako, sir. Kumbaga, I've been there. I've been teaching this nursing education for quite some time, for a long, long time. How will I fail NCLEX? And yet he failed. And yet he failed. We all learned it the hard way. So, the way you realize it, of course, the failure is devastating. And after that tragedy, sir, nung hindi ka pumasa, what were the changes you put, kumbaga, implemented to ace your NCLEX on your second
Um,
take?
Ganun pa din, sir. This time, yung klase ko is parang seryoso na. Inatenan ko na siya. Seryoso na. Lahat ng klase natin. Pero isa sa parang masasabi ko na is makakatulong is maghanap kayo ng partner. On my second attempt, before ako nag-start sa review, kasi na-failed ako nung June 30. So bumalik ako ng I think mga July 25 siguro after our vacation.
Mm-hmm.
And it so happened na yung classmate ko from grade school hanggang college is nag-review din pala ng IPASS. But
Wow.
Para sa niya na yun, para sa preparation para sa first leg. And yun yung which is parang lagi kong kasama-kasama na mag-review kami. Na parang review time na. So it would be easy siguro pag may kasama tayo na na parang same lang journey natin ba. Although andito naman yung asawa ko na nakakausap ko, but then hindi din kasi nila na parang nakapipili kung ano yung dapat mag-feel natin. Although my nurse is, ang asawa ko is nurse din, pero wala pa silang preparation sa NCLEX. So parang hindi niya alam kung paano yung napipil natin. Which is yun yung siguro. At saka yung bilid sa sarili siguro, parang bawas-bawasan. Unahin muna natin yung Diyos sarili natin. Kasi that time kasi parang yung tingin ko sa sarili ko, makakamit ko to, kaya ko to. Which is mali talaga.
So ayun, tama talaga yun. That's why lagi ko sinasabi, remove those stereotypes. Lahat ng stereotype, every stereotype you know with NCLEX, remove it because all of those are not true. Because at the end of the day, who's going to take the exam? Who's going to sit there and answer in front of that computer? It is you. If there is anyone who will fail or pass this exam, it's you. So don't listen to other people who would say, it's just easy. It's just an easy exam. You can ace it. Oh, you're good. You've been in the practice for quite so long. No? And this is also what we're emphasizing. No, it doesn't mean that you're a fresh graduate or you have a recent, even if you're an educator, no, it doesn't connote that you can really be a good, you can really ace this NCLEX. It doesn't go that way. Because the standards of US is different from our own standard. And we have our own standard in the Philippine setting. And, we're a third world country, so we adapt to our situation. And that's different when it comes to US. No, there's this situation, I'm always giving this example. Whenever your patient has a CTT, CTT, your patient has a chest thoracostomy tube, and suddenly the bottle suddenly breaks. What are you going to do first? No? The first thing we really do in the Philippine settings, and that is actually what been taught, in our local boards, is to clamp.
Yes, po.
And that's what you're going to see in the hospital. Naka-order pa nga yan ng doktor, di ba? Do clamp. And when it comes to NCLEX, it's not that. You should have to soak that tube into a sterile bottle with sterile water. And why is it? Because we have a different setting. In the Philippines, try mong gawin yon, di ba? Try to do that in your hospital. Ewan ko na lang kung ma-IR ka, di ba? Kasi you ordered something that will not be used by the patient. No, that will just stay there just in case. Hindi ganun yun, di ba? Pwede pa bayad sa yun. So we adjust with our setting, and Philippine setting is different from the US setting. So tulad nga nung sinabi mo, sir, you ace your HAAD. Of course, you've been educated the way HAAD practice. I'm not saying that it's inferior or superior. I'm not saying that, but they have different standards. It's just like applying to a different hospital. When you're in a different hospital, there are different protocols you have to follow. That is what you have to study. That's why you have your guide, which is the review center. Because they know, we know, our lecturers know, our coaches know what to do and how to do it. Diba? So that's one thing. No, I'm really happy that you realize that this is a different exam. I need to give focus. This time, I will not just review to show
Yes, po.
to my wife,
Family.
to my family, just
Yes,
to
po.
have the attendance, but also to really pass this exam because you already know how hard it is.
Yes,
Diba?
po.
Because it's easy to say it's an easy exam once you've done it. Eh. Diba? For me, for example, us, USRN already, passer of NCLEX, we can say, oh, it's an easy exam, kaya mo yan, di ba? Just take the exam, you can do it. But real talk, di ba? To face the reality, it is a really hard
Yes,
exam.
po.
There
Yes,
are a
po.
lot of people who fail facing it, and there's no shame with that. There's no shame with that. Just as what I was saying before, here in NCLEX, you don't really need to pass every day. You don't really need
Mm.
to be a nurse to be a USRN qualified every day. You just need one. You just need to pass once. You just need to succeed once. Even if you fail 7 times, it doesn't really matter. Because when you pass once, you'll become a USRN. When you go to US, they will not ask you, how many times did you take your
Yes.
NCLEX? Hindi naman diba? So this is really something we have to accomplish. We have to overcome, of course, this exam because this is sabi ko nga, I'm sharing with my students, whoever I'm coaching, will you allow this 80, this 80, 85 to 150 questions to hinder you from living your life, your future, for to hinder you giving a better life for your family? Of course, no. Di ba? Just 150 questions, yun na yun. Yun na yung katapat ng ano natin, ng future natin. No way. So I'll do my best. You have to do your best. And that's one thing. You have to respect the exam. You have to put your commitment. You have to put those sleepless nights and even your,
Yes, po.
of course, your effort. And one thing also that I've heard about you, sir, is your review body. No?
Yes,
Yeah,
po.
you told us na it's really helpful to have someone who would be checking on you. No,
Yes, po.
how are you doing? Or are you starting your review? Nasan ka na? So that's actually also the purpose why you have your coaches, and of course that's also the reason why you have your group chat. No, to have those people. Sabi ko nga, no, it's always easier to travel together than to travel alone. Palasak na palasak. This is a cliche, no? There is what we call this quotation, there is no man in an island. So we really need other people to join us, and there's no shame with that. Diba? What matters is success. It's easier to see people and to be with people who also have the same goal. And that's
Yes, po.
very true, sir, that even though your wife is a nurse who could also understand these things, even though NCLEX journey is a different journey, and it will
Yes,
give
po.
you different experience, different struggles you have to face, and you need someone who knows these things. That's why we have our coaching sessions.
Yes,
So
po.
ayun, sir, gusto ko lang din malaman, have you accessed your coaching session, sir?
Yes
And
po, si Ma'am Rosenda po, like 2 days yata
okay.
before ng exam po. Which is,
Mm,
classmate, nakakatulong talaga. If i-follow lang po natin yung guidelines kung paano yung schedule ng IPASS, for sure, lahat tayo USRN. Ganun
yeah.
lang po talaga. Follow IPASS. Roadmap, yan lang.
How did you use your roadmap, sir?
Yung roadmap, sir, mga 3-4 na beses kong binalikan, sir, sa pangalawang take ko.
Wow.
Like, yung ginawa ko kasi is from July 25 hanggang October yata, focus na ako sa klase ng IPASS. After noon, kung ano yung nag-archer ako, at saka bumalik ulit ako ng IPASS na klase. Lahat ng klase ng IPASS sindan talaga siya. At saka yung like 1 month before ng exam, doon ako nag-start ulit ng yung sa roadmap natin. At saka yung pasalamat lang ako, Sir Jay, nung first na exam ko, nung message ko sa kanya, bagsak ako, Sir. Sabi niya, don't stop. Huwag ka lang mag-stop sa pangarap mo. Just continue. Which is, umabsent lang ako ng 1 month para sa bakasyon. Tapos bumalik ulit. Yes po.
Si Sir J yun, sir? Si Sir J.
Oh, si Sir J. Yes po, Sir J.
That's very true, no? That's very true. You really have to, sometimes when we fall, no?
Yes
You
po.
have to rest a bit, breathe it all out, then stand up again. Because that's life, no? Sabi ko nga, life continue moving forward. Life continue moving forward. It will not wait for you, no? For you to be okay, for you to be fine, for you to be, okay ka na ba? Okay. Hindi eh. Life is, sometimes, no? There is harshness in life, but that's also the beauty of life, no? It's harsh at the same time. It's beautiful, no? To really have those experience, and sabi nga nila, those experience will make you even stronger, and it is what makes you a person. And no, even though you had your failure, di ba? Will you focus on the review if you didn't fail? You respected this exam. You had your effort. You gave your commitment because you know how hard it is, and you don't want to fail again. No, and sabi ko nga, no, everything happened for a reason. There are a lot of things that will happen in your life you don't really want to happen, di ba? So failure is something that we really don't want to happen, but those things happen for a reason, and you just have to see the positive in it. No, and at the end of the day, if you won't stop, you will really get it. Meron ng joke, di ba? There's a joke. Professor once said, every one of us will pass. Of course, every one of us will pass. The question is when.
When?
So the question is when. When are we going to pass? Every one of us will pass. Of course, if you will stop doing what you're doing, what will happen is that you will really fail because you didn't do anything, no? You didn't do anything. So what do you expect, diba? So if you keep on fighting, even if you fail, even you experience failures, what happens is this is the only there's a big chance you will fail also, no? There's a big chance you will fail. This is a risk, no? There's a big chance you will fail, but this is the only thing that will give you a chance to pass.
Yes po.
By keep on fighting, and we really have to keep on fighting, and that's the beauty of this journey. And I know, sir, no, we're very happy of your success. And eto, no,
Thank you,
nandito
sir.
rin yung coach, no?
Yan, aking coach. Napakagaling.
So ano ba mga napag-usapan niyo na, sir?
Yung mga advice ni Ma'am Rosenda, which is lahat naman pinalo natin. At saka yung classmates, importante talaga yung mag-approach tayo sa coach natin like days, weeks before ng exam. Kasi nakakatulong talaga ma-release yung anxiety. Kasi alam naman yan nila lahat sa pagdaanan nila.
So sir, tanong ko na lang din, no, how did you experience the second exam? How did you find the second take of your NCLEX?
Siguro sir, parang medyo okay na siya kasi sineryoso ko na yung review ng IPASS. Sineryoso ko na lahat. From July 25 hanggang January 9. Isipin niyo po, like January 10 yung exam ko sa Israel ng 8 o'clock. 2 a.m. pa lang gising na ako, nag-answer pa ako ng 100 items. Kasi kailangan mo talagang parang this will be my last shot. Alam mo yun, yung kailangan mo talagang may pressure ba? Aside sa pressure sa financially, pressure sa family, lahat-lahat na yun.
And ayun, no, nagawa mo naman siya, we're so happy.
Kaya nga po.
Sir, tanong ko na lang din, did you use your second question bank or your Archer? Kasi you shared with us a while ago that you already took your U-World, no, on your first day. Then this time you use your Archer. How did you use it differently?
Actually, sir, 2 beses ako nag-after. Noong July, nag-after ako, na-expire siya noong mga October yata. Kasi ang in-expect ko, makaka-exam ako ng October. Yung problema, wala nang schedule. So, nung ginawa ko is, after na ma-expire yung Archer ko, bumalik ulit ako sa IPASS na klase, lahat ng klase. So, like mga 1 month din yun. Saka nag-Archer na naman ulit ako. Sinaga ko lang talaga siya na 100 items per day. Parang 75 items per day. Tapos meron din akong Saunders na Q-bank din kasi. So doon ako sa nagfo-focus din sa Saunders din pag natapos lang. Basta yung ginawa ko lang nung 1 week or 10 days before ng exam po is 400 questions in a day.
Wow.
400 questions in a day po.
Grabe yun, no? 400
Oh,
question a day.
400. Yes po.
Wow.
Tapos kung may mga tanong ka lang doon sa mga questions na mismo, balikan mo lang yung klase, ando naman lahat eh. At saka doon sa roadmap natin.
So, grabe, no? Dedication talaga.
Dedication talaga.
That's real dedication. 400 question a day. Oh my God.
400 questions per day. Gising pa ako ng madaling araw. At saka parang yung siguro this time prayerful na ako. Kaya simula nung kasi, nag-pray naman ako pero alam mo yung believe din sa sarili mo. Yun lang talaga yung ma-advise ko. Like, humingi ka ng tulong kay God. Andyan lang yun si God, hindi yan mawawala. Tawagin mo lang. At saka yung commitment talaga na mapasa tong exam. At saka maniwala tayo sa mga tao na nauna sa atin. Kasi minsan kasi yung alam mo yun, yung siyempre halos lahat tayo working. At saka medyo tabu yan sa ibang tao na parang may mag-a-advise sa kanila. Ba't mo ako advisean? Pareho lang naman tayo. Maniwala tayo kasi wala namang mawawala. Kasi napagdaanan yan nila. Yung mga coaches natin. Kaya sabi ko nung nakaraan. Actually, nung first kasi hindi talaga ako nagpa-coach nung nakausap ko lang si Sir Jeno ng isang beses after hindi ko na inulit. Pero no, this time sabi ko sa sarili ko, parang siguro kailangan kong baguhin yung style ko nung before. Wala na yung pride. Kailangan natin mapasa to, kailangan natin yung mga tao na pwedeng makatulong sa atin.
So, ayun, no? Talaga yun. Yun nga sinasabi ko. Sometimes kasi we feel ashamed. Someone is helping me. Instead of thinking about it, no, think of it on a other perspective, no. Yeah. Instead of thinking na, it's really a shame to have someone to help me. Pero instead of thinking of that, think of it this way: you've managed to have your IPASS, so maximize it, no. This coaching session, in other review center, you need to pay for it, no. But in IPASS, this is free.
It's free.
If you talk to us, you can share with us your experience and whatever you're experiencing right now. What would you like to do with your review? And if ever you have any questions on how to do it, you can just ask any of your coaches, no? And that's true, no? There's no shame in that. Sabi ko nga, sir, anong mahalaga, no? At the end of the day, the most important thing is you as a USRN, di ba? You pass. No? And that's the most important thing. There is no shame on having someone advising you, di ba? And yun nga yun eh. Kung naiiyak ka man sa coach mo, there are your cycle mates, your classmates. And somehow, no, it's kind of corny, no? Parang wala, classmates, tanda-tanda na namin, no? Pero you will feel that eh. You will feel that eh. There are people just like you experience the same struggles. And parang atong klase talaga, you have your lecturers and your classmates, and somehow ones that will be with you together with your journey till the end. Sabi nga nung mga nakasama natin sa group chat, no, sa mga cycle mate, sabay-sabay daw nagtatawanan, sabay-sabay din pumapasa isa-isa. No, and that's wonderful, no? That's wonderful. And that will also give you confidence, knowing that there are these people who are just like you, being able to make it, no? And ayun, no? And that's very true. Yun. Yung isa lang din, sir, no, na siguro na notice ko, I would just like to take note of that. When you took your UWorld the first time, you were telling us that you just memorizing
the answers lang, sir.
Just
without understanding the
exactly. That's
ganun lang yun.
And even though it didn't really help you, doesn't it?
Wala.
So,
kasi meron naman kasing sinasabi na parang UWorld lang sapat na. Pero depende din kasi yun sa paggamit mo. So kung ano yung feeling mo na, ako kasi ayoko yung mga mahahaba na mga yung mga tanong at saka mga so kaya siguro na parang tinatamad ako magbasa that time. Siguro mali lang talaga yung paggamit ko sa yung atake ko sa first preparation ko compared nung pangalawa.
So ayun totoo talaga yun, no? And this is one thing I've been sharing with all our students, and I will share it again, no? When you use your Q banks, you just don't use it for the sake of the rationale. No, yes, of course it's important. It's important to have your rationale. But if you fail in a question, there are two possible things. There are two possible things why you fail with that question. First is, of course, maybe you don't know anything about it. Of
Mm.
course, it's hard. It's even impossible to answer something you don't know. Di ba? So, ayun, no? Sabi nga sa Latin, no? Nemo dat quod non habet. You cannot give what you do not have. If you do not have this kind of knowledge, then how are you going to share it? How are you going to apply it in your question box? So knowledge first. That's why we have your review center, you have your IPASS, you have your lectures. That's your
Yes po.
knowledge. Then the next thing you need is, of course, your test taking skills. That's why it's called skills. It's something you have to learn on your own. It cannot be taught. That we can give you test taking strategies. There are a lot of test taking strategies we can teach you, but applying these strategies into a question all depends on you. Sabi ko nga, no, instead of focusing on the rationale, try to understand the perspective of a question, because the question has its own mind, it has its own brain, it's thinking on its own. That's why whenever you answer a question, for example, you answer A, why is the answer B? Why is it not A? So instead of focusing, okay, the rationale is this, instead of focusing with that, just try to put yourself in the perspective of the question. Why? How is the question thinking, or what kind of perspective that the question have for me to answer the letter B instead of letter A? So that's actually the skill, because that's why we call this NCLEX very tricky. It's very tricky because the main thing why we can't really why it is tricky is because we're confused. Diba? We're confused to answer NCLEX. The main reason behind that is because maybe we don't understand. It's either we didn't understand the knowledge. That's why I say it's knowledge, or we didn't really understand the question. That's why, di ba?
Yes po.
Have you tried, sir, answering the question and you tried to, wait lang, hindi ko siya maintindihan. I will read it again. I will read
Mm.
it again. I will read it again. Have you experienced that while
Yes
answering?
po. Yes po. Yes po.
Uh,
Kailangan talaga.
and the main reason behind that is the first thing is because we don't really understand it the first time we
Mm,
read it. So
mm.
what happened is we read it again, and somehow we get something from it. Oh, na,
Yes po.
oh, this looks familiar. Oh, isa pa ulit. Another try. Oh, I will read it again. Okay. Oh, it's kind of malapit na siya, no? Pero I need it one more time. So you read it again and again and again for you to understand. That's actually your test taking skills, because it has its own trickiness, that for you to be able to decipher, you have to read it over and over again, or to have it experienced. No, that's why we have our drills, we have our pre-test, post-test, for you to be able to practice that, no, to also see the perspective of the question and be used to it. Now, oh, this is a
Yes
tricky
po.
question. The second question also just like that. Oh, this is another tricky question. Oh, this is if I will just base myself on how I'm going to answer a question, I will answer B. But because of the examinations that I have already taken, it seems like it's going forward to letter A. So I will try letter A. Then somehow you will realize, oh, it's correct. And somehow understanding these questions later on will be easier for you. Have you experienced that, sir, na parang nung tumatagal, when you use your archer, medyo dumadali yung iyong understanding of the question?
Yes po. Yes po, sir. Pag consistent lang talaga yung paggamit sa mga test taking strategy na tinuturo ng IPASS, malalaman mo yan along the way.
And that's it. I was always sharing, no, with my students na it's not the question. Hindi naman dumadali yung question. Hindi naman siya dumadali. The difficulty of the question is the same. What change is your perspective, your understanding of the questions, and that is your test-taking skills. When you have those two, knowledge and test-taking skills, there is no question you will pass this NCLEX, no matter what is the format. And we learned a lot with your experience, even though, no,
Thank
sabi
you.
mo nga, parang ano lang siya, parang you just became serious on your review, and that's it, you pass it the second time. But there's a lot of elements that you have already done in your review that really made this possible. So ayun, no, maybe just we're very happy and we're so proud.
Thank you.
We're honored to be part of your success.
Thank you
And
so much, IPASS.
maybe I think Ma'am Rachel also would like to share or say something about your experience.
Yan. Na nakachap ko na yung experience ni Sir Albert that he is a retaker. And guys, it's really very difficult if you are a retaker because of course you will first undergo like a devastating stage wherein you will think of yourself as kaya ko nga ba to? There might be doubts na kakayanin ko ba to or hindi. But if you are someone who's taking the examination and this is not your first examination, we really encourage you to just continue, to just persist on this one because as what Sir Albert mentioned, talagang makukuha niyo naman to. It's just siguro on the first examination that you have done in your first preparation, may kailangan kang i-change. May it be your attitude, may it be your perspective of the examination, may it be how you see the examination, maybe on the things that you are doing. And one of the things that we can do on that is tama yung nasabi ni Sir Albert, we have to probably lower our pride sometimes na kailangan natin ng other persons because it's better when we do it together. Because when we're just alone preparing for this examination, may siguro yung ibang person talagang may ma-contribute sila and your coaches can really do that because they have undergone this examination. We do not have any coach in the review program that is not a USRN because we want that someone who's going to teach you or to coach you, to advise you, has already gone through this kind of journey. So, makinig tayo sa sinabi ni Sir Albert na please communicate with your coach during the time na mag-inform sila sa inyo na you will have your coaching session. One of the things that I've also catch up, ito takeaway ko na nasabi ni Sir Albert is we should change our mentality na dahil andyan yung review center, talagang papasa na ako. Our mentality should be, there is a review center who's going to provide us all the necessary information na kailangan natin for me to pass the examination. But also, this is a hand-in-hand journey. Hindi natin makukuha yung NCLEX natin if magre-rely lang tayo sa review center. We have to be committed. Dapat magbibigay ka ng oras mo, magbibigay ka ng commitment mo for you to be able to pass this examination. Dapat seryoso tayo. So, hindi pwedeng i-rely natin 100% yung effort sa review center, but we have to give our wholehearted efforts dito sa pagre-review natin because your success will depend on how you prepare for your examination. Kung pwede lang sana na yung nakapasa na ng NCLEX, sila yung mag-take ng examination natin sa Pearson View, no? Kung pwede lang sana. But it can't be because you will be the one who's going to sit for the exam. And ang dala mo lang doon is your knowledge, the information, your skills. Kapag mag-exam ka, nobody's going to whisper you kung ano maging answer niyan. It's you, the computer, and God. Your faith and your belief in yourself. So talaga guys, kailangan ng preparation natin. For those of you who are new in the program, you might be overwhelmed by the information that you will encounter, pero let's do it step by step. Okay, let's do it step by step. And sa nabanggit din ni Sir Albert, if you have somebody who can support you, that would really be very helpful. Kasi at least nagkakaunawaan kayo sa journey na to. So sa nabanggit ni Sir Albert na share niya sa journey niya. Thank you so much Sir Albert. Guys, kung kayo man ay hindi pa, this was not your first examination, you never stop on dreaming for this because this goal is really intended for you. It's just a matter of time na makukuha natin itong license niyo. So never stop because you will all be able to make it happen. Okay? So continue, adjust sa preparation natin and maging seryoso. Hindi pwedeng mabanjing-banjing. Okay? Dapat seryoso tayo sa preparation na to. Kasi yung goal natin is makakapasa on your first take, or kung hindi man on your first take, talagang makukuha. Because makukuha nyo tong examination na to. We promise you that. We are here to support you all the way, but you also have to do your part.
Yes,
Okay? So yan lang. Thank you so much, Sir Albert, for sharing your story with us. And we are so fortunate that we are part of your journey, sir. Maraming salamat for inspiring those who are still going to take their examination, sir. Back to you, Sir Justin.
Ayun. So, ayun, again, we are very happy of your success and we're very proud of you, sir. And
Thank you, sir.
you're an inspiration to us for not giving up, no? And ito nga, si Sir Jay, yung nakausap. Sir Jay, next ka daw niya eh, when he failed the first time. And anong
nakapag-reply
sinabi
ba ako?
mo?
Hi,
Ano
sir. Good
sinabi sa'yo,
afternoon, sir.
Hindi ko na ma-remember lahat ng mga, I'm sorry pero hindi ko na ma-remember lahat ng mga estudyante, just like yesterday. So many messages yesterday. But I will really reply sa inyong lahat. It could be like later na, pero
Yes,
like
po.
I said, sometimes may mga nag-message sa akin na, for example, uy, hindi ko pala siya na-replyan dati, like a year ago. So I will still reply, like, so sobrang dami. But like I said, my heart is with you guys. So kung pwede nga lang, sabi ko nga, kung pwede nga lang, I would sit there with you, to take the exam. And then yun ang answer, let's do it together. You know what I mean? Like, kung sa tingin mo na, sir, hindi yan ganyan yung answer, ito yung answer. Yeah. So what I'm trying to say is that we're not really perfect. So it's like, kumbaga, it's a relationship, It's a relationship na we're together to reach this goal. Okay, so like I said the other day, it's like I would say like 1% from the review center and 99% the rest of them, 99% is you. So at the end of the day, who's gonna sit there? Ikaw, di ba? So hindi talaga. So wala kang katulong dyan, kundi ikaw, but we would like to really emphasize that we are here for you, to support you all the way, as in super all the way. And for me, it don't matter if you are retaker, third taker ba, o pang ilang beses ka pa dyan. What matters for me is, I know you're doing your part, you're doing your best, in spite of everything, na marami kang pinagdadaanan. And it's just a matter of time lang talaga. The license number is, there's a license number that is intended for you. And I'm really positive to that. And well, it's let's see you here, Mr. Albert, and to those here that are still, listening, struggling, and then keeping up, especially to those who are new here. I know it's kind of hard if you're having some, if you are new here, but dahan-dahan, ano lang siya, one at a time. So lahat naman ng bagay sa mundo dinadaan natin sa sa step by step. You cannot just simply like from one to the other. Ano ka, sinuswerte, bibigyan ka ng 1 million kaagad, for example in lotto. Well, it's a fortune, no, pero it's not. It's way different from what we're doing right now. I mean, it's way different from the NCLEX journey. All right? So ayun, sabi ko nga, it doesn't matter kung pang ilang take ka na or what. So what matters is that you didn't stop. You did your you did what is necessary para makuha mo talaga siya. Because the moment that you stop, of course,
Walang mangyayari, sir.
your opportunity will also stop, di ba? Kailan ka ba pasa?
January 10, sir. Pero yung first take ko, sir, nung June 30 po, yung nag-message ako, sir, na nasa Pilipinas ko yung nagbakasyon.
Tama. Well, that's my busy time for sure kasi nasa Pilipinas, But madami talagang nag-text din sa akin na sir, napasado na ako, sir. My first take was this, ba? Ganon. But well, sabi ko nga, it doesn't matter for me. Pass is pass. Kahit ang iba naman sinasabi na, sir, 145 items and then I pass, and then I really like it to be like 75 items. No, it doesn't matter for me. Pass is pass. Yung pinaka-importante. And then see you here in the US.
Inshallah.
So, ayan. With that, sir, congratulations, Sir Arbert Celona. And with that, we would like to present this certificate. This is a proof that Sir Arbert Celona is a safe nurse based on the USA standards of nursing practice, given this 8th of February 2023, given by Sir J. Padal and Sir Mark Zaspa. Ayan. With that, sir, congratulations again,
Thank
Sir
you.
Arbert.